and welcome to Picture of Health. Polk County's Indigent Healthcare Division works with local physicians and clinics to help our most medically vulnerable residents stay healthy. Today, I have the pleasure of sitting down with Joy Johnson, the director of the Indigent Healthcare Division, who is here to elaborate on just how important this division is to our county. Joy, welcome to the show, and thank you for being here.
Thanks for having me.
So I understand that you've kind of been giving presentations throughout the county, really trying to educate our residents on what the Indigent Healthcare Division does and how that is tied to the voter-approved half-cent sales tax. So why don't you start out with kind of talking about the history of where this idea to have a half-cent sales tax came from and that sort of thing.
Well, it goes back almost 100 years, actually. Polk County does have a long history of taking care of our most vulnerable residents, going back to the days where we had the Polk General Hospital. At that time, there was an ad valorem tax that funded that. And
for people that don't know what an ad valorem tax is, can you explain what that is?
That was a property tax.
Well, that's very short and to the point, but for some of us, if we've never heard ad valorem, we may not know where that came from. Okay. So please continue.
Okay, so through the property tax, that was funding the building of the hospital and the ongoing operations. In 1995, that hospital closed, so did county-operated primary care clinics, and then the community as a whole was left with a gap for a lot of people that still had a need. And so there was some limited general fund dollars set aside to take care of people through the Polk Healthcare Plan, which was voted for and approved. It's a healthcare program, social service program operated by the county. And so with limited funding, few people could get served.
And that happened in what, 99?
Yes.
Okay, but at this point, this isn't funded through a tax.
Right.
Okay.
Right. Not a half-cent healthcare sales tax, so that had not come into place yet. After a couple of years of the Polk Healthcare Plan operating and the few people being served and the big need not being able to meet that need, that's when efforts began to try to get a half-cent healthcare sales tax approved on the referendum. And that happened in 2004.
And why does a half-cent sales tax have to be approved? Is it due to the size of our population? Because I know in Hillsborough County, they had a similar thing where it was just kind of like, hey, we're going to have this tax.
Right. It's all dependent on the language in the Florida statutes. And because of Polk County's population and size, it has to go before voters. But before it can go before the voters to approve, the county commission has to vote in a majority to put it on the ballot.
Great. So in 2004, this tax took effect, and it's been in effect since then.
Correct.
But the program that is funded through that tax changed a little bit. So why don't you tell us a little bit about what that voter-approved tax actually funds?
Well, it funds quite a bit, actually. It started with the focus being on the Polk Healthcare Plan. Mm-hmm. The Polk Healthcare Plan is set up to serve a manageable number of people every single month. And when I say that, I'm talking about an average of 5,000 Polk Healthcare Plan members every single month. Some come on the program and some go off of the program for different reasons. But that's what we budget, because the funds are paying for people for primary care services, specialty care services. The hospital services are the most costly, oftentimes that and diagnostics. But a plan member will also have access to medications, which sometimes can be expensive as well. So we budget to serve on average that many people every single month. And we know that that's not the answer to meet all of the needs of the community. So we have since broadened the scope and looked at other opportunities such as public-private partnerships in the community to see what else can we do to open up more access. And that includes other free clinics, for example, dental clinics, behavioral health services. So we have really looked at the scope to try to make sure geographically we do have services in the areas where people may not have transportation or have access to those resources within their community. And we've looked at a number of ways, including our mobile unit, to try to go out into the community to bring some of the information and program eligibility information to them where they are. So it's grown from just focusing on the Polk Healthcare Plan to a broader partnership with a lot of agencies in the community that are not-for-profit.
So what are the main differences between the Polk Healthcare Plan and these community partners?
Our community partners can serve people who are up to 200% of the federal poverty level, which for a family of one is about $22,000, I'm approximating here, versus people who would be eligible for the Polk Healthcare Plan. They have to be under 100% of poverty, which is about $11,000 annual income for a household of one. And so those are some of the examples of the income guidelines. So you have to be, for the Polk Healthcare Plan, you are really the most vulnerable in terms of income and having the ability to afford, health insurance or anything else.
So let's just think about this for a second. So $11,000 a year for one person. So let's say myself, I have no dependents. I can't imagine what it's like to have to manage that small income and to have to take care of yourself and what other responsibilities you might have along the way. And I imagine it's very difficult to get any type of health care without having a program like the Polk Healthcare Plan on such a limited income.
Right, and for the Polk Healthcare Plan, you have to have no insurance. You can't be eligible for Medicaid. And these are people that fall in the gap oftentimes because unless they are pregnant, blind, disabled, oftentimes it's our childless adults that go without coverage. And so that's the majority of the population that we're serving through the Polk Healthcare Plan.
Right.
And it costs a lot more because oftentimes people do not present when they're healthy. They present when it's urgent or they're very
when everything's
ill.
hit the fan.
Pretty much.
Right?
And we want to make sure that they get established in a medical home so that they're going to get that preventive care. So they're not ending up in the hospital for a migraine or for a general toothache. We want to make sure that we're getting them established in the right setting at the right time.
Now, the community partners, you said that the federal poverty level limit is 200% or below.
Correct.
So for those individuals, what is, do they have health care? Are they allowed to have health care, insurance, or how might their circumstance, other than obviously like limited income, how might that be different from someone who's on the Polk Healthcare Plan?
With some of our community partners, what's unique is that some of them can be a provider in our Polk Healthcare Plan provider network. So they may be able to see them or try to screen them to see if they're eligible for the Polk Healthcare Plan. But in the bigger sense, they're going to serve a lot more people. The services that they're getting, it may not be the same thing that they could get if they were in the Polk Healthcare Plan, but it could be primary care, it could be specialty care, it could be dental care or behavioral health. The services are not set up in the same way that the Polk Healthcare Plan is. So it really depends on that agency, the specialists or the providers that they have access to. Our free clinics can go out and they do a very effective job at recruiting volunteer physicians to come in and see people. So it depends on what specialty of that provider that they're bringing in. It could be a gastroenterologist, it could be other types of backgrounds, and it may not be the same thing with each different clinic.
Now, I know in a lot of public forums and things like that, there had been a lot of concern expressed about mental health and about dental. What have you been able to do through these community partnerships to sort of increase people's ability to access these types of services? Now, I know that you have them in place, but I would imagine that after hearing so many things in those forums that you really put a focus on that.
That's right. In fact, we started with dental, knowing that that was such a huge need, and it still is today. This program is a safety net. It will not meet every single need, but our goal is to strive to make sure we can expand as much access for the services that we can for people. With dental, we simply don't have enough providers. We don't have enough primary care providers in our community to meet the need that we have for our population. But because we've been able to tap into this have since sales tax fund to use it as a match for grants, we've been able to generate additional funds to this community that we otherwise would not have gotten. And what we've done with some of those funds is used it to expand dental services. In 1 year, we went from just having 2 dental access sites in the community to having 10.
Wow.
And that has been because we've been able to use those dollars to work with our health department clinic.
And that's all over the county?
Mm-hmm.
Wow.
And that's our federally qualified health center to open up their dental clinics to meet our population who are under those criteria.
Right.
And so that's for dental. And when you talk about behavioral health, we also know there's such a huge need for that as well. So what we've done is work with our behavioral health providers. And when I say behavioral health, I'm talking about mental health and substance abuse. So they have agreed to put their therapists in a setting so they're co-located in a primary care setting. And the intent with that is to try to meet them where they're at, where they're presenting to get care. Oftentimes, physical health affects mental health, and we want to try to reach someone in that setting at the right time and wrap around other services that they may need.
Okay. Well, I feel like this is a good place to take a break, so we're going to do that. And when we come back, you can tell me what else the Indigent Healthcare Tax funds. So let's take a quick break for a segment of Nutritionally Speaking with Whitney Fung from the IFIS Extension Services.
Hi everyone, welcome back. My name is Whitney Fung and I work for the University of Florida IFIS Extension Service and the Board of County Commissioners Indigent Healthcare Division. We're back on Nutritionally Speaking and talking about some tips for eating healthy. We're on tip number 9, comparing sodium in our foods. And so first things first, we always go back to My Plate. So don't forget, I'm asking you from the last episode to this episode, have you been eating My Plate friendly? Have you been out to the website, choosemyplate.gov? If you haven't, then there's your homework. So definitely check that out. Today, we're going to be talking a little bit about sodium in our foods. And so sodium, it's kind of a bad thing sometimes. We need it for our bodies, but the thing is that Americans consume too much. And a high sodium diet can contribute to high blood pressure. High blood pressure can increase your risk for stroke. A lot of times, high blood pressure is also known as the silent killer. There's no symptoms, and we don't know if we have high blood pressure. So it's really important that you know your numbers, you go to the doctor, you know your cholesterol, your blood pressure, as well as your blood sugar. So know your numbers, go to the doctor on a regular basis, and see if everything's in check. But a lot of these things are diet related, and that's why we're here, right? We're talking about eating healthy, and today we're here to talk about sodium in our foods. And so you have to compare the sodium levels in the different types of foods because it's really up to the manufacturer to determine what they put in our foods. I want to ask you, how many of you read nutrition facts labels? So when you go to the store, you're buying your foods, do you turn it around, that food, and you look at the nutrition facts before you buy it? That's an important question because that's the way you know what you're consuming. So very, very important is to check your nutrition facts labels. So what I do here, I have 4 cans, but I'll go to the store and you turn those cans around and you just compare the sodium on those levels, on those labels. And so sodium is basically table salt, but sodium chloride. And so when you're looking at these cans, you have here some that are no salt added, some that are reduced sodium, and some that doesn't have anything on the can. That means that it's there may be salt in there as well. So you really have to look at the label and compare each of those. The best, of course, is no salt added. You'll see sometimes it says naturally not a sodium-free food. That's because that food already has it, but you know that there was no salt added to that product. So there's a few choices that you can have. It's the no salt added, reduced sodium, and the plain. And so if you end up buying the plain one that has salt in it, it's okay, you can drain it, you can rinse it, and that does decrease the amount of sodium you consume. And when you buy the plain ones, doesn't mean you can't add salt to it, just means that you can control it a little bit better, or try to limit it as much as you can, because maybe it's already too salty for your liking. So that's a good way to cut back on some salt, is by looking at those labels, or just simply choosing the sodium-free or no salt added or the reduced sodium option. So canned, fresh, frozen are all fine. The frozen foods as well, you definitely want to look at those labels, because a lot of times they're packed with salt. And so a lot of you might think that salt comes from the salt shaker. And so, you might like to add salt before you even taste it at the restaurant, right? Well, it's not actually from the salt shaker. More than 70% of our salt for the average American diet comes from processed foods. So all these canned foods, things like that, those processed foods, boxed foods, frozen foods, those are all the majority of the sodium consumption that we consume. So you definitely have to look at whatever menu they have, even at the restaurant. Ask them for the nutrition facts before you order that item, because it really can make a difference. The American Heart Association does recommend that every average American consumes about 2,300 milligrams per day. And so again, it's 2,300 milligrams per day. Definitely consult with your doctor if there's a different amount, or you might want to be on a different sodium restricted diet. It might be lower, but talk to your doctor. Sometimes it can be 1,500 milligrams, but follow that. Generally 2,300 milligrams of sodium per day, so that's your budget. You can play with it. You can have some salt, just don't consume too much, because then you may be at risk for high blood pressure. So definitely watch those. Look at your labels, watch your salt. And then here I have a little bit of the condiments, right? We use salt to season our foods, and so even soy sauce. I'm Chinese, so I like to use soy sauce, but definitely choose the reduced sodium soy sauce, because that just cuts back on a little bit more. And then I have a garlic powder here. And so any type of spices, natural spices, are great to use. Herbs, if you grow them, they're very, just it adds a kick to your foods, and it seasons your food in a healthy way. You don't have to add the salt. You can season it with all different types of spices and herbs. And so this one I pulled specifically because you don't want to be getting the garlic salt. You want to get the garlic powder. You want to get the onion powder, not the onion with salt. And then you can also check on the ingredient list to see if there's any other salts added to those seasonings as well. So salt, we all are going to consume it every day. You have a budget, you have that limit. You can look at American Heart Association recommendations, talk to your doctor, but that's one way that you can control the amount of sodium you consume every day, is by looking at your nutrition facts labels. So I definitely encourage you to do that for all your foods. That's really all we have today. Thanks for being with us, and I hope to see you next time.
Welcome back to Picture of Health. I'm speaking today with Joy Johnson, the director of Polk County's Indigent Healthcare Division. Joy, you shared a lot with us about some of the programs that the half-cent sales surtax funds, but I know that's not all. So tell me what else is in the works here?
Okay. Well, the programs that I described previously, they are optional. They do not have to exist, but we do have a dedicated funding source that can fund those programs. We're also using this same half-cent sales tax to fund healthcare-related mandates. So when I say mandate, that means that by Florida statute, it is required by the counties to fund. So we do have 4 programs. The largest mandated program that's funded through this sales tax is Medicaid. And basically every county in the state of Florida is required to provide a share of the cost for their Medicaid population. And so that is for every single county. The cost for Polk is about $10 million. And right now we do have about 155,000 people in Polk County who are Medicaid eligible. So we do track those numbers, and a portion of this fund goes to support that, just as it does in every county. The second program would be our Healthcare Responsibility Act, and that simply requires that if a Polk County resident were to cross the county line and go to another hospital in another county, Polk County is responsible for paying the cost of that if they're an indigent resident of Polk. So we have to verify that, their income, and we get the claim, and we basically have to pay those claims to the hospitals, and that comes out of this fund. And Polk County has to, by law, budget $4 per capita in our budget to pay that. That comes to about $2.4 million, but we really don't spend anywhere close to that, but we do have to budget that amount and not spend it. We actually spend about $500,000 a year for those residents. And so another mandated program would be our behavioral health match. So this is for our mental health and substance abuse provider agencies, being Peace River Center and Tri-County. And in order for those agencies to receive their funds through the states to operate the programs, they have to have a local match. So the county does provide some of those funds for them to get the funding from the state to operate the programs. It comes to a total of about $1.1 million, and that's for behavioral health. But I will tell you, as we discussed, there is a huge need for more behavioral health services in the community, and so we do fund above and beyond what's required. We have over $3 million.
So your community partners that also provide behavioral health services, you're saying that you fund above and beyond that?
We do.
Okay.
We do, and in fact, the funding that is above and beyond the mandate is what's going for the co-located therapists at different settings, or for other types of criminal justice, mental health, and substance abuse programs. So there's a lot of different things that we're trying to create access for, so that people don't continue to go through the system, that they can get care in the right setting.
So, I'm sorry, I may have missed it if you said this, but so what would be your total contribution to behavioral health, both with your community partners and with this mandate?
I would say it's slightly under $3.5 million.
Okay.
Probably close to $3.4 million.
All right.
So we also have what we call core services through the health department. So this is a mandate for the health department to provide core services in their with their counties. And so while the mandate is on the health department, it also includes that the counties would work in cooperation with them and provide some funding for the services that they offer, such as the environmental health, communicable diseases, you know, those types of things that they do in the community, disease prevention, preventable health. So those are some of the programs. Now, the funding that we provide is around $380,000. However, the health department also is one of our community partners. They provide primary care and dental care to those who are uninsured in the community, who are Polk County residents. So we do fund them above and beyond that mandate, and that is for them to open up more access for people to get primary care and dental care.
Wow. So how many people would you say approximately are you serving through either your Polk Healthcare Plan or your Community Partners Program?
Our community partners serve on average about 36,000 people a year right now. And through the Polk Healthcare Plan, as of last year, we served about 6,000 plus people a year.
So around 42,000?
Yes.
That's impressive.
And when we look at our census numbers, you know, we do want to have a goal or a target. So we know that there's slightly under 100,000 people in Polk County who are uninsured. Of that population, there's about 57,000 people who are within the income criteria under 200% of poverty that we could potentially serve. So that's our target, and so we've served about 75% of that population as of last year.
That, I feel like that's pretty impressive to actually be able to hone into that demographic. I know this is kind of a touchy question, but for those who may be curious, you mentioned the coverage gap, and I have my ideas about how that happened. But why, after the Affordable Care Act was passed, why are there still people not being covered by either marketplace insurance or some type of insurance?
Well, there's a lot of reasons. Okay. I'll start with the Affordable Care Act. The way it was originally written was that all states would expand Medicaid. That piece of the law eventually went to the Supreme Court, and that piece was overturned, so making it a state option. Well, in Florida, we do not have Medicaid expansion. So that marketplace that's out there for people to go in and get private health care coverage, that is only set up for people between 1 and 400% of the federal poverty level, because the people between 0 and 100% would have ultimately been covered through the Medicaid expansion, those childless adults. So that is our coverage gap. That's the population that we really target to serve. However, we do know that there are people who may, on the surface, may appear as if they qualify for coverage through the marketplace exchange, but oftentimes people do present to us and show us, what those premiums and deductibles and copays are, and we have people who are, trying to make sure that they are keeping their electric on, keeping food on the table, and taking care of their kids, and they can't really afford those sometimes doubled, increases in those costs, and the benefits sometimes have not changed. So it works for some, not others. What's good is that we do have some community partners that can step up to the table and can provide some level of care for those people who may not be able to afford that type of coverage, or still may not be able to qualify.
And Medicaid's got a pretty stringent criteria in order to qualify, from what I hear. And you mentioned some of that. What are some of the criteria?
You have to either be pregnant or be blind or disabled. Those are some of the different types of qualifications that you have to fall in to get some level of Medicaid coverage. So oftentimes the childless adults are the ones who are left with no options if they're not either offered insurance through their workplace, or they can't afford any other type of health care coverage, or they don't qualify for Medicaid.
Okay, so if you have minor children, then you probably will qualify for Medicaid.
You're more likely to qualify
Okay.
than if you didn't have children.
Right. I think it's pretty awesome that our county has these services available, and that you all have such strong partnerships with providers in our community.
I think one of the things that is important to keep in mind, and that is extremely valuable, is that this program, that the voters who live here decided to vote to tax themselves, it is governed, it's operated, administered here locally. So that means people who live, work, and play here, the stakeholders are the ones determining how this program is set up. What types of services do we want to fund? How much do we want to fund for those services? Where do we want them? So that's what's really unique here, is that this is our program in Polk County. And so we can determine the people who, they have a voice, and if they want to speak up and express that concern, they absolutely can. And it's going to be vetted by someone who is actually living here and has that ability to determine the direction of where the program goes.
One of the coolest things I think that you all have done is you've taken feedback from the public, and you said, okay, like everybody's saying that we need more behavioral health providers and we need more sites for dental care, and you've heard them and you've done what you can to increase those access points. So I think that just goes to show that part of the system works. You mentioned that we have all this buy-in by approving the sales tax and voters in Polk County and that sort of thing. So because it's a sales tax, does that mean that everybody is contributing, or is it just people that live in Polk County?
It's not limited to people who just live in Polk County. It really is a broad spectrum. It's anyone making purchases. So it could be property owners, it could be people who rent, it could be tourists, people just traveling through, stopping to shop around. So it also includes the people who are actually benefiting from the services because they live here and they are consumers as well. So everyone can contribute toward this program, and that's one of the things that makes it very unique as well.
About how much money does the sales tax bring in?
It can generate anywhere between $35 to $40 million a year, depending on where we're at in the economy.
Wow, okay. Well, we're out of time, but thank you so much for being here and talking with me. And hopefully we've helped clear up some confusion some of our viewers might have about the program and how it's funded.
Thank you.
You can watch this episode again on Mondays, Wednesdays, and Fridays at 10 a.m. or 4 p.m. on PGTV, or you can catch all of our previous episodes on our YouTube page. I'm your host, Lauren Lingell, and I'll see you next month on Picture of Health.